So we're sitting on our front porch yesterday evening around 5:30. Pretty much every evening, rain or shine, we have three rockers from Cracker Barrel on our front porch. We kind of have one of the. It looks like a southern friendly front porch with three rockers, one for each of us, and we sit out there every evening and have our cocktail and munch on some pub mix, or I like the rice crackers. So last night I'm munching on my rice crackers and I thought, wow, why is there a rock in the rice crackers? Now, they are made in China, so I shouldn't eat them, but I do like them. And so I get a little sketchy, but I'm like, oh, crap, what am I chewing on? I pulled it out and looked at it and went, oh, that's not a rock. That's a tooth. So I broke off a huge chunk of tooth on the lower right last night. And it's a tooth that has a very large filling in it from probably 40, 50 years ago. And now I'm avoiding going to dentists, doctors, hair salons, nail salons. I really haven't been anywhere since March other than going to the office. And now I'm going to have to go to the dentist. Yeah, going to have to do something about it. I'm really not happy. And the funny thing is, 4 years ago, we were in Bermuda and we were having breakfast and I was eating a bagel. And I did the same exact thing. Why is there a rock or they didn't grind the flour for these bagels very well. There's a really large piece of something. And again, tooth, that one was upper left in the back. And the one on the upper left, my dentist has been after me for 4 years he actually wants to pull the tooth. And I'm like, it doesn't hurt. It's a perfectly good chewer. Why would I pull a perfectly good chewer? Well, I don't think this one's going to be as friendly. It already is a little, so I'm going to have to go do something with it. The one behind it has a cap on it. So I don't want to go to my current dentist who just is happy to yank teeth out of my head. I kind of like to keep some. So I'm going to call the guy who put the cap on that's next to it and see if he can do that on this one. I don't know if there's enough tooth left to make a cap. So, and man, let me tell you, nothing against dentists personally. I hate going to the dentist. Like, that nails on the blackboard thing. Man, I'll sit and listen to that all day long before I'll go to the dentist.
Oh, you support good dentistry.
I support good dentistry. I am just scared to death. So I had to have a root canal years ago on the other side, on the bottom. And the dentist said that, I forget what the problem was, but he said I needed a root canal. So I went to the dental specialty center. And when I got in, I should have taken something before I went because I was like this. And I was such a wreck. And the problem was I had looked up what a root canal actually is before I went. I knew too much. And I was like, that sounds like the worst torture. I mean, I don't know if you know what one really is, but once you look it up, ugh. So I was just petrified. And the specialty dentist, looked at me and said, "Don't be such a baby. Suck it up. What's wrong with you?" Now, I should have slapped him. I should have gotten up and walked out. But I stayed crying and got the root canal done. About a week later, I called my dentist and said, "Okay, I had this root canal a week ago. When does the tooth stop hurting?" He said, "What do you mean?" I said, "I have just as much pain now as I did before." And he said, "Oh, that shouldn't happen. When you have a root canal, they take the root out. There's no more nerve ending there. Therefore, there's no pain." So now I was really mad, and I went for a second opinion to the guy actually who put the cap on this side. And I explained the story, and he took a metal probe and tapped the teeth down where the problem was. And he hit the tooth that had the root canal, nothing. Hit the tooth behind it. I just about went through the ceiling. And he said, "Well, there's your problem. They did the root canal on the wrong tooth." Oh my Lord. So he said, you're going to have to go get another root canal. And I said, over my dead body, I'm never doing that again. So he put a cap on it. So what I had was a cracked tooth. The tooth was actually cracked. You couldn't see the crack. He x-rayed it. He found the crack. And so he said, well, we can try capping it and see if that works. If it doesn't work, you're going to have to go get a root canal. Well, that's been probably 10 years. And God bless him. That one's still holding up. So I'm going to go back to this guy and hope.
It's been longer than that because that was before me.
Oh, it was before you?
Yeah. So it's lasted very well.
Oh, so it's been like 15 years if it was before Hugh. Anyway, yeah. Oh my God, no wonder you don't want to go to the dentist. Yeah, I don't have good experiences with the dentist. When I was a child, that was before there was fluoride in the water. So, and there wasn't fluoride in toothpaste and whatever. And not that I'm a big fan of having a bunch of stuff added to our water, but, and there was a penny candy store in the little tiny town that my grandmother and grandfather lived in. And so my grandmother would give each of me, my sister, and my cousins, when we would stay at her house for the day, she would give us each $1. Well, that's 100 pieces of candy. So we would run down to the candy store. There's only like 10 houses in the whole town, but there was a candy store. It was the only store. So we'd run down there and we'd get our 100 pieces of candy and then spend the next couple of days eating our 100 pieces of candy. So when I was a kid, I had cavities like I had really soft teeth. I had cavities like nobody's business. So my parents would take me to the dentist every 6 months when I was 4, 5, 6, 7 years old. And I would literally have 12 to 15 cavities every time. So then it would take 3 or 4 trips because they couldn't fill them all at once. So, every couple of weeks, I'm back in that dang dentist chair and your mommy didn't get to go back with you. And I was getting, needles in my jaw every couple of weeks and fillings out the wazoo. Luckily, when all my baby teeth fell out, all those fillings went with them and my adult teeth came in stronger. But so, I started out with this huge fear of dentists. The only good thing about it was we got a toy out of the little toy thing at the end of every visit. And they had these little eraser animals, rubber animals. And my sister and I probably had 100 of them. And we set up little towns and we played with them. They were like our favorite toy. So that was the only redeeming thing about going to the dentist is we would get more little rubber animals that we would play with all the time. So I have this just really unnatural fear of the dentist, which is bad.
Aren't there 2 beings here that are about to, actually multiple beings?
Yeah, and so that brings us to what else is going on in our family. We have 2 cats and 3 dogs that all need to have dentals done. I'm taking 1 cat today. So yesterday I said, all right, I've been saying I was going to get complete blood panels on everybody. We're a little overdue. And so Hugh and I drew blood on all 4 dogs. And then we took the blood and 2 cats over to the office and had someone else help us get the blood on the cats because they're not quite as friendly about that. Because Hugh didn't want to get killed getting blood from cats. They were actually very good because my technician was our good cat handler. But in the process, I looked in our kitty cat's mouths, which I don't do very often, and said, oh, geez, kitty cats need dentals. Both of them, same tooth, upper left. It's a little premolar. Both of them have dental lesions in them, which are similar to a cavity that we would get, but they're very painful. And you can see them right away on the smaller cat eggplant. The tooth is kind of purple, bleeds if you touch it, very painful. She chatters. So she's going first today. Going to see if Cindy has time to get her dental, and we'll have to pull that tooth. And then Buddha will be the next to go, and we've got 3 dogs who are getting in line. So going to be lots of fun around here in the near future. Okay, I got to get to work. Got lots to do.